Redivus Health, Module 2, Patient Event Navigation. To begin a new patient event, press the plus sign at the bottom of the screen. Tap the event pathway needed to treat your patient, enter patient identifiers, and press Confirm to begin. Within the header, you will see patient initials and room number, as well as timers. Stroke events will display an arrival timer and last known normal timer, as well as the calculated pretreatment NIH score. Sepsis events will display an arrival timer and a time zero timer. Timers will turn red to warn you that a critical intervention is due. In this example, the 3-hour sepsis bundle timeline is approaching, and the bundle interventions are not yet completed. The timers will turn green if the interventions have been completed before they are due. The Footer tab provides the ability to toggle between the Step screen, the Document screen, and the Team screen. Enter into the Team tab at any time to add a team member to your patient event. Within the Sepsis or Stroke Step screen, you can input information into the first 3 steps. The grayed out steps are not yet actionable. For example, to enter into Step 1 of the sepsis pathway, press the Start button, set the patient's arrival time, select the appropriate answers, and press Continue to move forward. Utilize lab and radiology checklists to aid in diagnosis and treatment decisions. Input your patient's clinical information. In this example, the user is adding a source for infection into Step 2 of the sepsis pathway and entering time 0. Now the user is adding organ dysfunction information into Step 3 of the sepsis pathway. Once information has been entered into those first 3 steps, the treatment step will open and provide you with an individualized treatment path. In this example, the patient has severe sepsis with hypotension and requires a 30 ml per kg fluid bolus. The user enters the patient's weight into the fluid calculator to obtain the fluid goal for this patient. The fluid does the trick, and the patient is no longer hypotensive. The repeat lactate is less than 4, so bundles are now complete. If the patient continued to be hypotensive, or if the initial or repeat lactate level is greater than 4, then the patient has septic shock and might require vasopressors. Here is the 6-hour bundle to complete for septic shock. Once you have completed your event, press on the Document tab to view your event documentation. Within the Document tab, you will have the ability to review all documentation, email documentation, delete erroneous or training mock events, or archive the event. By archiving your event, you will remove the event from your active events list and store it in the archived events list. Here's an example of completed documentation. To email the document, simply press on the letter icon, enter the email address, and press Send Email. To store the completed event, press the Archive button. Congratulations! You have completed Module 2, Patient Event Navigation.